It was me, not you. Okay, now I'm good. Now we're good.
So, you know, I try to figure out what is causing their cognitive issue and what, most importantly, like what can be done to try to improve it. And oftentimes there's not a simple, easy fix, but maybe like a list of things they can kind of work on that usually include like improving sleep quality or exercising to the best of their ability to improve the blood flow to the brain or improving their mood. So that's basically my clinical role. And then I also do some research, and I did do a small study about this very topic, CBD, THC, marijuana, cannabis. I'll go through what these terms mean, but basically looking at whether these things are effective in some of the symptoms of Parkinson's disease, and you know, what is the actual data that we have and we know, things about safety, things about legality. So I'm going to share my screen so you can see my slides.
What happened?
We're giving you your.
So you can all see this?
Yes.
Great. So again, I'm going to talk about CBD, THC, medical marijuana, and how they've been used in Parkinson's disease. So cannabis is sort of an overall umbrella term for the plants that contain these compounds called cannabinoids. And types of cannabis are marijuana and hemp. These are flowering plants that contain chemicals, natural, but still chemicals that you can take out of the plant and that may have effects on our brain and our bodies. And some of these effects are really complex. So there's a lot of research looking at, you know, various what we call cannabinoids or things from these plants and how they affect our brains and our bodies. I've just listed there the various types of cannabis, sativas, indicas, and ruderas. By the way, a lot of these terms I may not be pronouncing correctly. So if someone can correct me on any of them, I'm open to hearing it. So cannabis has a long history of being used medicinally that actually dates to around 500 BC. But it's important to note that these compounds have changed, and the way that they're derived have also changed over time. So just because something's been around that long doesn't necessarily mean, well, it must be safe. So I'm going to get into that too. And then there are also synthetic cannabinoids that mimic these plant-derived compounds. And there's one called nabilone that was developed as an anti-nausea drug. So like just colloquially, we know that people report smoking marijuana and having like the munchies or increased appetite. So, you know, there is a part of an action of these drugs that can help with nausea. And the nabilone is actually a regulated an approved substance for the specific treatment, not necessarily in Parkinson's disease, but for nausea, I believe, for people who are taking like chemotherapy. And then you may wonder, why do these compounds do anything to us? So we have what we call an endocannabinoid system. So endo meaning within our bodies, cannabinoids, the compounds I mentioned, there's a system of receptors that are within our bodies where these compounds can sort of connect onto and cause changes. And we've also produced natural chemicals that bind to these receptors. So this endocannabinoid system is involved in regulating our mood, our pain levels, memory, appetite, stress response, immune function, and sleep. And, while there's a lot of research and studies, scientists don't know completely how the cannabinoids affect our receptors and how they're actually working. So that's where, we have these already in our bodies, but then people do what we're talking about is ingesting from the plants, the cannabinoids that can affect this system. And one interesting fact that I threw in here at the bottom is that people who are diagnosed with Parkinson's disease tend to have fewer of one of the types of receptors, the CB1 receptor in the basal ganglia, which we know is a part of the brain that is affected in Parkinson's disease. So we don't actually know why they have fewer of these receptors, but it's an interesting thing to note when you're thinking about applying these compounds, medications, when there's already a difference there. Phytocannabinoids. So phyto meaning derived from plants. So the endo is in our body, the phyto from the plants. There are two main types that we're concerned with that you've heard of, THC and CBD. So THC is primarily in marijuana. It's known to be psychoactive, and we'll talk a bit about that, the effects it can have. It can induce symptoms of psychosis or anxiety, but it may help with pain, appetite, and interestingly, anxiety. And then CBD is primarily in hemp, but it's also found to some degree in marijuana, and it seems to have some sort of calming effect on the nervous system. There is one CBD product approved by the FDA that is for the treatment of a form of epilepsy that's usually in children. But other than that, there are no other approved CBD or FDA regulated products. And it's not thought to give people that high or the effects that you think about when you think about THC. And then to complicate it even more, people often take a mixture of both THC and CBD, and there may be effects that both have together that they don't have alone, and these can be positive or negative. So it's important to remember, even with other medications, these things can interact and cause effects that neither one alone did. And I think you all know that's why before starting a new medication, a doctor would need to know all of your other medications to make sure that it's safe. So, we have research for many medications and many disorders, but why is the research limited in this particular area? So federally, marijuana is still considered a Schedule I drug, potential drug of abuse. Other limitations are that we don't have standardized doses that are, to base studies on. So it's hard to start a study when you're not sure like what would be an appropriate safe dose, but a dose enough to be effective. We're lacking that data. And then we need clinical trials so that we can narrow down what symptoms can these compounds actually help, what ratio of CBD to THC might work for which symptom, and then the specifics of CBD not being FDA regulated brings a lot of issues when you're trying to do a clinical trial that's legal and safe. Okay. So I want to just present to you my own small research study that I did The study's limited in that it was interrupted by the pandemic. So I had collected data from 15 people, and then the pandemic hit, and I considered collecting more data via Zoom for everyone's safety. But when you're measuring cognition and memory, the tests that we use are, you can use them over Zoom, but there can be major differences in the results. So I analyzed the data, and I have summarized it here. So basically, because CBD and THC are being prescribed in some circumstances, I wanted to look at how people are using these products and the effects. And I measured cognition, so memory, language, attention. I did a MOCA and then other tests. I looked at people's attitude toward these compounds that they were taking. And I compared them to a small group of people with Parkinson's disease who were not taking any CBD or THC during the course of their Parkinson's. So again, it's only 15 people. This is a small study. You would never make any grand conclusions from this, but what I found was interesting. So of the 7 people who were being prescribed either CBD, THC, or both, I don't think I had 2 people in my study who were taking the same product. Not the same product, but the same dose, the same regimen. Everyone, it was like a mix of all kinds of ways of prescribing it. And then secondly, people told me that they were taking it for a host of symptoms. So we can't just really think of CBD and THC for Parkinson's. We have to think about, okay, are you trying to treat tremors? Are you trying to treat dyskinesia, depression, cognitive difficulties, sleep, REM behavior disorder? Like, we need to figure out what are we targeting. And in this small sample, I had a range of what people said they were taking it for. And what I found on top of that were the people who were taking one of the products had a lower MOCA score overall. That was significantly lower. And they also had more non-motor symptoms of Parkinson's, which would include the anxiety, the depression, the cognitive difficulties, all the things that are not motor symptoms. Now, I'm not saying that the CBD and THC cause these things. What I'm saying is I'm looking at people at one point in time. The group that was taking it scored a little worse on those 2 things. I think that people who try these medications might be attempting to help a symptom that they've been told can be helped with alternative therapies. So I can't really draw any big conclusion from that, just that I noticed, or I found that those 2 differences were there. I did more extensive cognitive testing too, and I didn't find any differences between the groups. So the MOCA is just like an overall cognition. It was a little lower, but when I actually measured their memory, their attention, their language abilities, those things were pretty much the same. So what accounted for that difference is unclear. And then I collected some people's descriptions. So when we're looking at numbers and data, we're not looking at people reporting things on their own, but here I did add that in. So this is not statistical, this is more observation. So the group that was using a CBD, THC, or both reported, I mean, these are people's verbatim responses: better sleep, eases their back pain, eases their anxiety. Less anxiety, better sleep, less tremors, reduced pain in their legs. It caused relaxation, decreased anxiety, and decreased depression. This person said it wasn't exactly positive, just okay, made them somewhat relaxed. Another person said pain relief, and another said improved sleep. So you can see the overall theme here: anxiety, sleep, and pain. Now, describe some of the negative effects you've encountered. One person reported feeling sleepy, which they felt was negative. Maybe it was like during the day. One had concentration loss and forgetfulness, which is important. We'll talk about that a bit. And then 5 of the people reported no negative effects that they could determine or notice. Now, I want to be clear that this is just people's, not just, but this is people's reporting. It's not numbers, significance, or anything like that. It's just qualitative data. But it is interesting. But you have to remember, the people who were in my study were taking these compounds because I'm assuming they started taking them, they liked what it did for them, and they continued. People who had taken these compounds that said, oh no, this is making me dizzy, this is increasing my anxiety or my tremors, probably stopped the medication. So it's important to realize that when you collect data in this way, there can be biases. But that being said, overall, the people who stayed on it had a positive experience. So I just wanted to go through a few other, some larger studies and published studies of other researchers. And I just wanted to bring to your attention that you may see headlines like, okay, marijuana for Parkinson's disease. Now, if you actually read this article, they're talking about theoretical potential for effects, but nothing substantiated through any kind of study or actual data. So you'll see a lot of papers like that where there's this theoretical way that it could help, but it's not clear that it actually does. And I think that's, these studies are important, and it's how new things are found, but sometimes the titles can be a little misleading in that they've already found it when we're still not at a place where we have that kind of solid evidence. And another one, evidence for the use of cannabinoids in Parkinson's disease. So again, they're talking about data similar to my data where people report that it helps, but they've actually haven't really measured, the data is not overwhelmingly supportive of these compounds. And part of what makes it hard to study is that, like I saw, people take a variety of substances, the ways they take it, vaping, edibles, tinctures, all of these things are different. They're metabolized differently. The doses are different. They've been on it a different amount of time. They're targeting different symptoms. And it makes it really difficult when you want to look at the data to figure out if it might be something you'd want to try. And then people will sometimes ask, so what makes a clinical trial important? Why do we need that as evidence? It takes away the bias and things like placebo effects. If you randomly assign people to a drug, you control the amount of the drug, the type of the drug. You make sure that what you're doing is safe by monitoring things. I'll show you a study where they did find some changes that were concerning. Some disorders like Parkinson's can have placebo effects where you can improve motor symptoms by administering placebos because people, I won't get into why that is, but it's possible in the disorder to have a placebo effect and think what you're taking is having an effect. And that can also be useful in treatment, but you'd have to figure a way to do that. And then I wanted to just mention that what is actually approved by the FDA, but I'll mention it here. There is some evidence for one of the CBD compounds, Epidiolex, and it's used in children who have a specific type of epilepsy. So it is approved in that one area, but for Parkinson's disease or anything else, it would be being used sort of off-label. And that CBD is regulated in the way that you know what's in it, whereas the CBD that you might buy from the pop-up stores that I see around, or like I've even seen them at farmers markets, there's no real way to know exactly what are in those bottles. So I'll go through a few more of the studies. This was the one I wanted to bring up. This was a trial where people weren't actually assigned to the groups. They were taking people who were taking these compounds, and they found that there was a possible effect of CBD for improving what we call a quality of life. But they acknowledge you would need like a larger sample of people before making any definitive conclusions. And they found that there was not really any improvement in motor function. So they weren't really sure what caused the improvement in quality of life. Could be mood, could be reduced anxiety, similar to my data, maybe better sleep. And then just very recently, this study was published. Now, what this study is doing, it's a systematic literature review. It's combing through all of the literature to look at all the studies that have been published and give an overall summary, which kind of makes my job easier in terms of presenting it, because now someone has looked through all the data and come to the conclusion about using cannabis, CBD, THC in Parkinson's disease. So their main findings are that there are a lot of papers talking about the issue, but few clinical trials, like I talked about, where it's controlled and people are given a certain dose and medication. The sample sizes have been generally small, which is a problem, especially in Parkinson's, because people can be so different in terms of their Parkinson's disease. People are taking the medications in different ways. And then they noted some unpleasant side effects that were found: sleepiness, dizziness, nausea, vomiting, tachycardia, low blood pressure, which we know is an issue sometimes in Parkinson's disease, dry mouth and diarrhea, loss of balance and fatigue, and some psychiatric symptoms like disorientation, confusion, hallucinations, and altered mood. They note that usually these symptoms are more pronounced at the beginning of treatment. And of course, they're all undesirable, and it can exacerbate symptoms people already have. Like I said, low blood pressure, visual disturbances, and Parkinson's disease. So it's one major concern when using these compounds in Parkinson's. But similar to my data, they find that people subjectively, so thinking about themselves, report positive feelings when they use some of the compounds. So they do report reduced anxiety. Some reported actually reduced psychosis symptoms like visual hallucinations. And what they concluded was that there's really a need for larger studies, longer term studies, standardized procedures, placebo control. Like we said, placebo is a big part of figuring out if something really works. And they concluded that non-motor symptoms like pain, anxiety, and sleep seem to respond better than the motor symptoms. And if you think about that, we have a lot of treatments for motor symptoms, but it's the non-motor symptoms that are lacking in treatments. So they do make that sound a little more promising, that if it were really studied, maybe there'd be an indication. And they said that future studies should really focus on the non-motor symptoms, especially as those really relate to quality of life. And another really recent study looking at the overall evidence, they reviewed all of the trials that have been done, and they again conclude there's no compelling evidence for its use. However, there were potential benefits for anxiety, pain, sleep, and quality of life. So very similar to the other large review study where they're just acknowledging there's no hard data, but people again do report some improvements in those areas. And just an example of that, this study did look at the use of the compounds for REM sleep behavior disorder. And while they didn't find that it actually helped the REM behavior disorder, they did find that people reported an improved sleep satisfaction. So again, another study showing they can't really show that it helped the actual sleep issue, but the people that were in the study reported that it helped their sleep quality. Now, one area where cannabinoids have shown effects are in like chronic pain. And there have been studies that look at this type of chronic pain, neuropathic pain. So things like pain from dystonia. And they do find that it's effective for pain. So that is one avenue where if you wanted to specifically target pain and you talked to your doctor and it was safe, that it might be indicated. And again, this study looked at anxiety and found that people who took 300 milligrams of CBD compared to placebo had less anxiety when put in an anxiety-provoking situation, which was a public speaking. And they found a decrease in tremor amplitude. But I think the tremor here that they're really referring to has more to do with anxiety than the tremors of Parkinson's disease. But again, possibly effective for anxiety. And this is the CBD, not THC. So overall, again, the research is still pretty limited. And the reasons for that, I think, are multi-factored. You know, the legality, it being a Schedule I substance, you would need federal support to look at these compounds in a clinical trial, and some have, but it's not easy to do. Very few controlled studies, again, but so what are the potential treatments in movement disorders? So just from this overall data, there is some possibility it could improve dyskinesias or reduce anxiety or depression. Pain, again, has some strong evidence. Muscle spasms, sleep dysfunction. So while the sleep disorder wasn't improved, people's perception of their sleep improved. And then weight loss, which can be an issue in PD. It can be effective for improving that and nausea. And then the basic science shows that CBD may be an antioxidant and could possibly be neuroprotective. But again, there's really not a lot of clinical showing of that in the data. And then importantly, there are risks and side effects. And I've listed them here. So memory and executive functions like problem solving, dizziness, low blood pressure, mood and behavior changes, loss of balance, which is a big
Are you
issue.
calling me? Okay.
Some forms of these products can cause hallucinations. And then if you're smoking or vaping marijuana or cannabis, it can affect the health of your lungs. And then the FDA on their website does talk about how CBD has the potential to harm you. There's some evidence that it can cause liver injury at certain doses. And there was a study, I think I have it next, that did show that. It can also interact with, say, alcohol or other drugs in terms of your brain activity, change your level of alertness. Some people have gastrointestinal distress. So there are just many aspects about CBD that we don't know. What if you take it daily for long periods of time? We don't know the effects. How do different methods of consumption affect the intake? So if you're taking a certain dose, if it's vaped versus oral, swallowing it, that can affect how it's absorbed. The effect of it on developing brains, which, that's more relevant for children. How it interacts with other medications, or people are sometimes taking other supplements or herbal things. There can be interactions. And this was a recently published study that found using CBD in Parkinson's disease, they were using a rather high dose, and the people in the study developed a significant level of elevated liver enzymes. So again, this was the FDA approved CBD, so they can be sure of the dose. But like I said, when you're buying CBD products off the market that are not FDA regulated, because the FDA doesn't see it as a drug, you won't know the dose oftentimes. So, these people were in a study being monitored. So once their liver enzymes elevated, I'm assuming they took them off the CBD, but you might not be aware of that. And then 37 states, I believe, now have approved marijuana for medical use. And some of the states, I think it's 13, it might be more now, have Parkinson's disease as a qualifying condition. And I've listed, what people would need if they were to seek a prescription for the medical marijuana. I think it's important to first talk to your main doctor, like movement disorder specialist, before trying these, because they will have insight They prescribe, they see people who are prescribed these things more frequently, and they can tell you their clinical knowledge about it and also make sure that it's safe for you. And then again, the only FDA approved indication for CBD is for the seizure in children, the seizure disorder. For all the other health claims, there's really not yet enough clinical trial data to allow the FDA to state whether CBD is effective or not. And there's definitely not enough data to support the use of one type of formulation over another. But, people are still kind of enthusiastic about this potential. And there are ongoing studies. This is one that I posted here. So if you're interested to know what current studies are going on, you can go to clinicaltrials.gov and, type in search terms like, if you put in motor symptoms and Parkinson's disease, you would find this study where they're looking at whether CBD can improve motor symptoms in Parkinson's. So the study is ongoing. It looks like they've already recruited everyone, but they're still measuring those people's outcomes. So again, if you're considering the treatment, you really want to talk to your doctor to get their perspective. Hopefully you have a doctor that you trust their clinical knowledge. They may not be experts in marijuana or CBD, but they likely see patients who use these compounds, and they can tell you their experience. Any product containing THC, you would need a prescription for the medical marijuana. And now insurance will not cover the cost because, again, federally, these are Schedule 1, considered Schedule 1. So potential drugs of abuse. So they're never covered through insurance currently. So those are my references that I used for some of the information. And I'm happy to chat or answer any questions that I might know.
Thank you, Amber. If you want to get rid of the screen share so we can all see each other, that would be great. Thank you. Hi, everybody. Well, that was very informative. I actually got kicked off in the middle, but I got to come back for most of it. So I'm really glad, and hopefully we recorded. It looks like the recording continued. So I too will review the recording myself so I get all the information. I was wondering if people have some questions. You can put it in the chat or you can raise your hand, whatever you prefer. Anybody have some questions? You can call it out, not really just unmute yourself. Anybody have questions? There was a lot of material there and a lot of really good, valuable information.
I have a question.
Okay, who's that?
Kathy.
Oh, hi, Kathy.
I am sitting in for Dave.
Go ahead, Kathy.
I was curious, in a lot of these studies, if you knew more about the history of people having used marijuana, like if that was something that they had used in their past recreationally, or did it matter? Was there any, or do we not know? You know what I'm saying? I just thought that was, like if I'm somebody, or my husband is somebody who really never used marijuana regularly, I was just wondering how that compares to, other people that you have data on. I don't know if you know that.
Yeah, so you're asking, would having used it in the past change something about you that might make it more or less effective? Or yeah, that's an interesting question. So there's some data that marijuana early on can cause some brain changes, but I'm not sure then how that would relate to years later using it for like Parkinson's or another disorder, if it might. Yeah, that's a really good question.
Amber, I have
Just
a
a thought.
question,
Just
actually a
something on
couple.
Go ahead.
You said mocha in one part of the thing, and what is that?
So the MOCA is the Montreal Cognitive Assessment that is used to, it's just sort of an overall level of cognitive ability. It asks questions about what is today's date? Can you remember this list of words? Can you do this math problem? So it's just a way to get an overall sense of someone's cognition. And I use it in my study just as the first measure, but then I go on to measure each cognitive area more in depth because the MOCA can only tell you so much. I mean, of course, if someone's MOCA score is very low, you'd be concerned about their cognition. Like if they're unable to tell you even the basic things like not just today's date, we all forget that sometimes, but like the year or questions like who is the current president, things like that. It just can let you know where someone's at cognitively overall.
Okay. My next question was, does CBD come in different, what's the right word? Forms?
Yes, it does.
And is
There-
that easily available at like drugstores and stuff?
So yeah, so that was one thing that's important. CBD is available many places. The issue is that because the federal government is not regulating what is in the product, you cannot be sure what you're buying. There is a federally regulated product. It's the Epidilia. I'm sorry, but it starts with the E. The one that I mentioned in my talk that is approved, and it's CBD, and it's approved for that form of epilepsy in children. It's not approved for other conditions though, but I do believe like people use it off label. So that might be the safer option when you're looking at trying CBD. You could ask the doctor about prescribed CBD that's regulated, because when you buy the products from, like I said, I see them at farm stands and everything, you really can't be sure. Now, that might sound paranoid or something, but there are times where you've seen issues come about. Like I remember it was a green tea extract that people were taking because, you know, how could green tea be harmful? But the way they were extracting it and the levels of some of the compounds caused people liver injuries. So it's important to know what's actually in the product you're taking.
Well, the FDA doesn't regulate supplements that are sold all over the place either.
That's right.
So it's not just from a CBD perspective.
Absolutely.
Okay, thank you.
Somebody asked a question in the chat. Oh, Joanne. Hi, Joanne. What is a COA certification for CBD?
Oh, I'm trying to remember now. I might have to get back to you about that.
Okay.
Some of the legal stuff I have to look up repeatedly because I forget. It's not my. So when I look that up, like a certification of analysis, it's from a third-party lab that shows what is in your CBD product. So I guess it, that's one way in which you could get more information about what are in the products, that if a lab has analyzed the product and can tell you. But the other issue is that we don't know exactly what doses are safe. And you saw that one clinical trial where they were doing the CBD at a high dose and people developed the elevated liver enzymes. So sometimes even when you know what's in the product, if the dose is high or not appropriate, it can cause issues. But those are all things that a medical doctor would advise you. And if they couldn't, they should refer you to someone who does know, because, a lot of medical doctors, this is not their area of expertise, but there are doctors who do specialize in this.
Okay, thank you for that. All right, someone else have a question? These are all great questions. Somebody else? Yes, Marilee, go ahead. You have to unmute yourself, Marilee. We can't hear you, Marilee. You have to unmute. Go ahead.
Okay.
You're good. Yep.
You said that pain is one of the things that the compounds can help with. I don't know. We've been lucky so far. My husband Herb has not had pain. Is this a necessary? Is it going to come in the future if he lives for this, or is it necessarily a part of Parkinson's pain?
No, everyone is so different in the symptoms that they have over time. So it's not, and I'm sorry, I didn't mean to present it that way. It
You
can
didn't.
be, yeah, but it's not necessarily something that would come, or, we can develop pain for any number of other reasons too. So, I mean, most people will have some pain in their lives, whether it's chronic or,
Of course.
yeah, short-lived. So no, I don't think as a rule, but I think it's more common because of some of the other symptoms like the dystonia or physical issues. It's more common. So it is a common issue that people with
Thank you.
Parkinson's, yeah, but not a guarantee.
Thank you. Someone else? You have a question? Kathy, is your hand up? I can't tell her. David, I see a hand.
It is.
Oh, go
I'm
ahead.
sorry.
Go ahead. No,
I'm
go ahead,
bringing my
Kathy.
camera.
No,
Hey,
go ahead.
this is just me, maybe just not understanding a little bit, but just going back to what you were talking about in the beginning. When you talk about medical marijuana per se, is it always a combination of these two components, the CBD and the THC, or is it all CBD, or that's the part that confuses us. We're not
Yeah.
clear on that.
Right. So the marijuana or cannabis, you can call it either, contains both, but at different levels. And I see that people who get the medical marijuana they're able to say the ratio of what is in the product. So like people will tell you, oh yeah, 15:1 ratio THC to CBD. So they are aware of what is in the product in the medical marijuana.
So then this is an oral compound. Is that what that is? Or it could be
I think they prescribe it in various forms, even medically.
Okay, that helps me. Thank you. Appreciate it.
Yeah, it has both. The natural, when you say natural, like I want to be clear, natural doesn't necessarily mean like safe or anything like that, but they're natural plants that are growing and they often contain both THC and CBD. And like we said, THC was the one that can have psychoactive effects, like even as far as hallucinations, but not for everyone, of course.
Thank you. Okay, anyone else? Still have a couple minutes to ask some questions. Yes, is that Victor? Yeah, you have to unmute yourself, Victor. Nope, still muted. Victor, you have to unmute. No, there we go. There we go, Victor. Go ahead.
Right, so is there any reason to believe that the use of medical marijuana can help to reduce freezing, Parkinson's freezing and Parkinson's fascination? And also, it's kind of a multi-part question, but also, is it known to reduce the dyskinesias that suffer from medications, the Parkinson's medication?
Amber, could you hear that? I had trouble hearing it, but could you hear
I
it?
heard bits and pieces, but I think you were asking whether the medical marijuana might help for freezing, or might it help for the levodopa-induced dyskinesia?
Yes. Right. And there was one other thing I was asking about. Destination, which is kind of goes hand in hand with freezing.
That last part I didn't get, but
Victor, you're breaking up. If you could speak. Yeah, part of it's hard to hear because you're breaking up.
I'm in the car.
Maybe closer to the microphone.
Louder. The other thing was festination. Parkinson's is called festination,
Oh, festination.
which is kind of like micro steps. I'm asking if you can help me think about that.
Okay, he's talking about festination, Amber.
okay, so I didn't come across any studies that addressed it. But I did see some of the studies looked at the dyskinesia from the medication. And there wasn't any, for any of this, I really don't find any hard evidence that it's effective or any specific dose or compound. But I think there was a study that found people reported some improvement in that symptom.
Not for festination.
That I did not see in any of the studies.
Thank you.
Thank you, Victor. Okay, other questions? Anybody? We're about to wrap up, so this is your last opportunity. Okay, I think we got it. All right, everybody. Thank you, Amber, for a wonderful, wonderful presentation. Lots of great information. Just so you all know, this was recorded, we hope, and it will be on the Freeburg JCC website, and I and Charles will send out the link as soon as it's uploaded. We are hoping next month to do a support session in the evening on senior living options. We will have an attorney. We will have some people talking about differing living options. We'll talk about how to move, how to get yourself packed up, all the things related to living and moving, which is always a big issue for people. I think it's going to be on a Monday night in March, I think March 21st, but I will get the word out to everyone as soon as I have that solidified. All right, everyone. Thank you again, Amber.
Thank
Everyone
you.
have a
Thank you.
wonderful,
Thank you,
wonderful
Amber.
afternoon, and take care of yourselves, everybody.
Thank you all.
Thank you. Thanks,
Bye.
Gloria.
Thank you.